Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Dr. Leslie Lapato and Dr. Beth Malow, thank you so much for joining me on Public Health on Call to talk about your fascinating work with Braver Angels. And maybe I'd start with you. Leslie, tell us about your organization.
Braver Angels is a national nonprofit organization that was founded after the 2016 election by a small group of people who wanted to get together some Trump supporters and some progressives/liberals to talk about why we're having so much trouble talking to each other. And the goal was to try to allow each side to see the other side as human beings as opposed to villains. And they started out with a workshop in Ohio, which progressed to a bus tour in the Midwest. And then we developed a number of different workshops that are oriented towards bringing together people from different perspectives to give them a safe opportunity to talk to each other.
What an interesting idea. And Beth, tell me in general how those sessions went.
Really well. People were pretty anxious in the beginning about how it would go. I was involved in Braver Angels since almost the beginning, 2017. And when you would tell people, hey, I'm going to go to a session or help lead a session, Leslie and I both help lead some of the workshops that we do at Braver Angels, people would look at me like I had three heads. Really? You want to talk to people about politics? What's wrong? It really has been very uplifting to see the reception that we've gotten from the public for these workshops. People are hungry, I think, especially now, for figuring out how they can talk with their Uncle Fred or Aunt Sue or whatever.
Yeah. It's easy to be mean and nasty online, not so easy to keep that up in person. I wonder if people reacted differently when they were actually looking at someone who held a different view from them.
I think that makes a big difference. Yes.
I think it's a lot harder to hate somebody that you've actually made a connection with, a personal connection, at first in a room and now even over Zoom. So it really changes your sense of who those people are, quote, the other side from you.
We take a lot of pride in the ground rules that we put together. Even if you don't know the people that you are working with in a workshop or whatever debate, we are very intentional about how we should treat each other and what rules we should conduct each other in. And I think that makes a big difference too.
So if we were about to start one of these dialogues and you were to get up and say, okay, here's some ground rules, what would those be, Leslie?
Okay, well, one of them is that everyone is worth listening to, that we are here to share opinions and to listen to other people's opinions and their stories. We will speak respectfully to each other. We will ask questions of curiosity and not what we call gotcha questions, which are the ones where the question embodies the answer. So those are some of them. I know, Beth, have I missed something critical? I'm not used to thinking about them anymore.
One that I love is we will speak freely, fully, and without fear. That's one we always say. And the reason that's important is we're not trying to be nice. We really are trying to get our point across. We may very well differ with someone very strongly on an issue. It's the way we do it. We do it in a respectful, curious way. We build trust and we build relationships as we're going along. And I think that's the difference. We're not trying to be nice. We're trying to be respectful and build those relationships.
One thing we always tell people is you're not there to persuade the other person over to your point of view. You're there to try to understand their point of view. And that's sometimes a hard thing to do in political conversations because you're used to trying to convince somebody that they're wrong and you're right.
So let's move from the general Braver Angels mission to the kinds of conversations that you've had on health topics. Tell me about those, Beth.
We got started with the public health initiative during COVID-19 pandemic. For obvious reasons, there's a lot of erosion of trust that has gone on. We have had several forums at our national meetings. For example, we brought together people like Francis Collins, former director of the NIH, and along with some other leaders in the field. Jay Bhattacharya, who's now the director of the NIH, came to a conference and spoke. We also have had more grassroots involvement. We did 3 COVID workshops, as we like to call them, where we worked with community members who were either supporters or questioners of the public health response to COVID. And we worked that very much like one of the classic, we call them red-blue workshops in Braver Angels, where you bring people together across differences and you share stories, you debunk stereotypes, those kinds of things, build trust. And then the latest thing the latest workshop that Leslie and I have been working on together is to work with public health officials who have, let's say, constituents, people they're serving in the community who are upset. And they may be upset for different reasons. I mean, sticking with, let's say, just take childhood vaccines. They may be like, why should I inject my child with that substance? Versus, why aren't you being harder on people who don't want to get their kids vaccinated? It's putting all of our kids in danger. So we're learning how to deal with both sides of the issue and teaching them how, or working with them so they can be more impactful and effective in dealing with their people they serve.
Yeah. Now, I imagine that the right question for me to ask is not who won in those discussions. I'm gathering that. Okay. So what I want to ask you then, and I'll start with you, Leslie, is what insights do you all glean from these kinds of conversations? What happens that's surprising? What informs one side of the other side? How did they learn from each other? And I'll start with you, Leslie, and then I'll turn to you, Beth.
Yeah, it's a good question. I mean, this project started out with a conversation between Francis Collins and Wilk Wilkinson, who is a conservative kind of medical freedom advocate who's very active in Braver Angels. And they kind of expected to go at each other, cats and dogs. But it turned out that they were surprised to find that they had some things in common, that they had a lot of respect for what the other person was saying, and that they actually developed a kind of friendship among us that has lasted. And I guess I would say the same has been true for me. Okay, so, what I found is that the people that I speak to who are on the other side, who are, what are commonly called COVID deniers or anti-vaxxers, are not by and large crazy people. They're people of genuine concerns. And a lot of the concerns are ones that I share. But we have different sources of information. We have different ideas about what the solutions are. But when you see people as reasonable or at least thoughtful people, and you don't demonize them, it really helps you feel like there's somebody there that you could potentially work with. And that's the direction that we hope things can move.
Yeah. And to add to that, one example from the workshops we held was not painting everybody, right, in the same light as an anti-vaxxer or anti-masker or whatever. So we would find, for example, that both groups, whether we like to call them questioners of the public health response or supporters of the public health response, both groups cared about health in their community. They just viewed it in a different way. One group the supporters might say we want to really minimize every single case of COVID that we possibly can, while the questioners were like, health means keeping your schools open. Health means keeping your businesses open. So if we have some lower level of COVID, it's more important to us that we not close the schools and shut down the businesses and that we can get outside and enjoy our lives. And that's a measure of the health of a community too. And we've come to learn, for example, that some of the academics and test scores in our kids have been affected by the pandemic, and the lockdown. So, it's helpful when you don't paint everyone in a certain way. And that's been a great lesson for me.
Tell me about the sessions you've had with public health officials. What have you learned from those? I know that many have been very frustrated at the breakdown in communication that can happen with their communities, especially as people are picking up information online and getting very angry at their local health officer, for example.
Yeah, so I can speak to the public health officials. Yes, I feel like they have that sense of frustration. On the other hand, our goal in teaching them these skills is to help them be more effective. And we said previously that we don't try to change minds at Braver Angels. I actually think sometimes people feel like they want to be impactful. They want to explain, for example, why a certain public health initiative is important. And what we teach is if you first help somebody feel heard and listened to, and that you're not blowing them off or labeling them or as Leslie said, calling them crazy or whatever, they're more apt to hear you and hear your point of view. Therefore, the public health officials, many of them who have taken our workshops, seem really pleased because now they feel that they can really have a receptive audience who's willing to listen to them because the people they're talking to have felt like they're listened to and they're heard. And you're working with them rather than in an adversarial way to improve the health of a community.
I think for me, we're both physicians. And so we've had lots of dealings with public health officials, public health workers, community workers, different sorts of practice situations. And it was shocking to me the kind of venom that was out there and the degree of anger that people were feeling towards people who basically saw themselves as trying to help and trying to save people's lives and make things better. So what we wanted to do was to give public health workers and officials a way to feel empowered to have conversations in kind of contentious situations and to feel that they could do that in a way that might be productive, that might help us help repair some of the relationships and some of the lack of trust in their communities. And that's what the workshops did, was to offer people some skills that they can use. They're kind of basic skills to be able to talk to people that they disagree with.
And so you do these workshops with public health officials. Do you get feedback like, hey, I tried this and here's what happened?
Well, we're at an early stage of that. So in fact, we're about to send out our first, it's about a six week post workshop feedback that asks exactly those questions. Did you try it? How did it work? If you didn't try it, why didn't you try it? What else do you think you need to make it easier to use? So
Right.
that is the $64,000 question, as we used to say.
Got it. That sounds pretty important. So if it didn't work at all, you'll give me a call back and we'll do another podcast.
No, actually, we won't say it yet.
Immediately after, we do ask questions about how things went with the workshop, how they're feeling, those kinds of things. I like, though, that we're doing this post 6 week because we all know what it's like. We can come out of a training and feel, wow, this is great. I'm going to change everything. Time goes by and you get busy and you haven't had that conversation you've wished you've had. So we're even asking questions like, if you haven't had that conversation yet with someone, why is that? And
right. Well, that's good. And I really appreciate the work that you're doing because it can feel like these divides are uncrossable. But when you get with people and you talk to them, possibilities open up and people can appreciate where other people are coming from. And hopefully that leads to a place where people can be more comfortable living with each other. And in the case of public health officials, a place where public health officials can make more considered decisions and people can respect them.
And feel included.
Yeah.
If the people in your community can feel included in the decisions you make and how you make them, I think that can go a long way towards getting support and more trust back, which is really what we need.
Well, thank you both for your work. Thanks for coming on the podcast to tell us about it.
Pleasure.
You're very welcome. We enjoyed it.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.